Welcome everybody to our monthly community transformation webinar. I'm Megan G and I'm the communications manager for the community transformation programme. Really great to be joined by so many of you today, so thank you so much for attending. We have got a really great session planned for you today. I'm joined by a number of my colleagues and we're going to be doing things slightly differently. Today we're going to be having more of like an open kind of panel discussion around kind of East Sussex and the developments of the neighbourhood mental health teams. So we're going to have a very, very short presentation at the start, but the majority of the slot today will be kind of opened out to all of you to be able to ask any questions that you've got, to kind of share any kind of comments or feedback. And between us, we'll all kind of do our best to be able to respond to that. We do always have a kind of Q&A section at the end of the webinars, but we really wanted to kind of let that be the main focus of the next couple of sessions that we're running. So hopefully that will be helpful for you today and will be informative. But just to kind of get us started, I've got my usual kind of housekeeping just to make sure that everybody's able to kind of engage with the session in the way that works for them today. So as always, the session today is being recorded. So we do record all of the sessions as we find that quite a lot of people like to watch them back and kind of share with colleagues and contacts after the webinar's taken place. So after the session today, we will obviously download the recording. We'll send it around to everybody who registered. So do obviously feel free to share that widely. All of the webinars also get uploaded to our YouTube playlist that we've got, and we've been doing these sessions now. I think it was November 2022 that we first started, so we've got quite a kind of library of them now. So this session will get added onto that playlist. So do obviously revisit that if there are any that you haven't been able to tune in to over the last couple of years. And obviously, because this is going to be on the YouTube channel, just to say that if anybody would prefer to kind of keep their camera off or to anonymise their name, please feel free to do that. We want everybody to be able to kind of engage with the session in the way that feels most comfortable for you. But equally, everyone is very welcome to have their cameras on and kind of join us on screen today. But please don't feel pressured to do so. And then if anyone would like to turn on live captions, you can do that by clicking the three dots that say more in your toolbar on Teams. And then if you go to language and speech, you can then choose to turn on live captions, if that's helpful. As I say, we're going to be predominantly doing questions and answers today. So there's a couple of ways you can kind of send those through. We've got the chat box, which I'll be monitoring throughout our session. We've also got the Q&A box, which you'll see a little speech bubble in your toolbar, and you can put your question in there, and I'll be keeping an eye on those. But equally, when we come to the questions, you're very welcome just to raise your hand and we'll come to you. So lots of different ways that you can interact with us today. And then lastly, your feedback's really, really important to us. As I say, we've been doing these sessions for a long time now, and we want to make sure they continue to be informative and helpful and that the format's kind of working for you. So in the email that I send around later on, there'll be a link to a very short survey, which I'd really appreciate if you can complete, just to tell us kind of any kind of comments or feedback you have about the webinar itself and any suggestions of things that would be useful for us to cover in a future session. So if you do get the opportunity, please do take a moment just to complete that for us. And so all the webinars can be watched back on the YouTube playlist. So there's a QR code on the screen now. Don't feel like you have to scan it now. I'll send around the slides after the session, of which this will be included. So you'll be able to access the playlist from there. Okay, so that's it for housekeeping. And we thought we'd start off the session just by giving kind of a bit of an update kind of from the programme overall. Obviously, this is a Sussex-wide programme, and though today obviously we are focusing on East Sussex, we thought it'd be helpful to share a little bit of an update of kind of what's been happening in all three areas at the moment. So as you'll be aware if you've tuned into previous sessions, there's a lot of work underway at the moment for us to establish our new neighbourhood mental health teams. And as part of that, a lot of work is underway for us to either kind of rework existing meetings or establish new ones. And in doing that, help bring together kind of different colleagues and organisations and teams so that we can be working together in a much more joined up way. And this is kind of that first part of us establishing those new neighbourhood mental health teams, so we can make sure that the people who kind of need to be in the room in those conversations as part of those teams are there, and that colleagues can then start to kind of build those working relationships together, as we then obviously move into kind of the next phase of the mobilisation. And then there's been a lot of work happening recently around communications. And as I say, I'm the communications lead for the programme. So if anyone doesn't quite have any questions about that as we come into the discussion, please do feel free to ask. But there's been a lot of work underway for us to develop. Sorry, is it saying my camera's off?
Yeah, it is.
Oh, that's weird.
It's okay.
Is that better now?
Yes. We can
That's so
see
weird.
now.
It was saying that my camera was on, but
there you go.
We've been experiencing lots of technical problems this morning, so that could be another one. Thank you for letting me know, Glenn. We've all just been staring at a screen. So as I say, we've been preparing a range of communications to go out to a number of different groups, including our clients and service users who are currently accessing services that are going to be becoming part of the neighbourhood teams, our colleagues in primary care, our staff who are going to be becoming part of the neighbourhood mental health teams, as well as kind of wider partners and members of the public. So we've been pulling together kind of a range of different resources, including kind of letters, posters, screens that you'll start to see kind of in community spaces such as GP surgeries, just to help raise people's awareness and understanding around what a neighbourhood mental health team is, what the kind of immediate changes might be that people start to see or experience, and then what are the things that will be coming kind of later on as we move into the spring of next year, just to help respond to some of the questions that we've received kind of in forums like this around people just wanting that clarity around, well, what does it really mean for me? So hopefully that will start to help support people kind of in their own kind of awareness and understanding of what this is and what we're trying to achieve. And then lastly, just to say that there is an ongoing piece of work to help establish more kind of integrated and joined up ways of working for all the different colleagues and teams that are coming together. And one of the kind of big things that we're trying to overcome is that at the moment, a lot of us are using a number of different kind of clinical systems or digital systems, which can make it very challenging for us to obviously share information and be able to kind of access, you know, people's latest kind of records and information about their care. So there is an ongoing piece of work at the moment to develop and implement a new electronic patient record within Sussex Partnership Trust, which will be the same as what a number of other partners, including primary care, use, which we really hope will make a big step forward in us being able to work much more collaboratively. So that's an ongoing piece of work which you'll continue to hear updates about kind of in these forums, but also I'm sure in other spaces as well. But we felt it was important to just highlight that it is definitely something that's underway and we feel will really help greatly in terms of our overall ambition of what we want neighbourhood mental health teams to be able to achieve. So that's kind of it in terms of the programme updates. I also just wanted to kind of remind everybody of the different ways that you can continue to obviously keep informed and updated about the programme. Obviously, we've got these sessions, which obviously you know about as you are here, which is great. We've also got a monthly newsletter that goes out towards the end of the month, which again, anybody can sign up to. So if you aren't already, please do subscribe to that, as that includes information about the overall programme, as well as some specific updates locally for the area that you might work or live in. So do have a look at those. If you're a member of staff working for a voluntary sector organisation, we've also got the Sussex-wide VCSE Mental Health Network. So if you aren't already part of that, please do obviously get in touch with Rosie Hayward. The contact is on there. To be able to find out more about that network and how you can get involved. And then we've also got a web page on the NHS Sussex website, which hosts all of the latest kind of information and resources, all the previous newsletters and webinars just in one place. As obviously this has been kind of a programme of work that's been running over a number of years now. So we've tried to bring it all together so that people can kind of get a sense of what we've been up to and kind of where we are now. And then lastly, we've also got an email address that you can contact. So this is managed by the kind of central programme team. So if you do have any kind of questions or comments about the Community Transformation Programme, you can always get in touch with us there, and we'll obviously come back to you as best as we can. So the last thing I wanted to share with you all is a piece of work that's currently underway, which includes colleagues working as part of the Community Transformation Programme, but also partners involved in the Urgent and Emergency Care Transformation Programme, as well as colleagues from across the health and care sector, staff, partners, people with lived experience, families and carers. And this is, you may have seen earlier on in previous webinars or newsletters that a group was formed called the Mental Health Services Communications Working Group, and their aim was to help improve the way that people can find information and ultimately access support for their mental health in Sussex. And as part of that, they have worked over the summer to develop some new consistent mental health signposting, which is now being used and adopted by organisations across Sussex. So the aim is that regardless of which website somebody goes to, you know, whether it's Southdown, whether it's UOK, whether it's a local authority, whether it's Sussex Partnership, they'll be presented with the same information about kind of what to do if you are experiencing difficulties with your mental health, and it's categorised based on how a person might be feeling at the time. So we rolled out that new signposting in the summer, and I'm really pleased to say that as a follow-on from that, we as a group are now developing a Sussex-wide campaign, which is due to launch at the start of December and will run over Christmas and into the New Year period. And the aim of that campaign is to really just raise awareness of the support and services that are available in Sussex, but also the importance of us all, you know, really prioritising our mental health and well-being. And it really focuses around that question of how are you really feeling, and asking people to kind of check in with themselves as to how they might be feeling, or to ask that question of someone they work with or a loved one, a friend, so that we can hopefully start to encourage people to not wait until they are at a particular point to seek support, but to try to seek information and support at an earlier point, and the options that are available to them in their local area. So my plea to you all on the call today is that when the campaign launches at the start of December, if you see it on social media or if it's sent to you within your organisation or your team, please just help us to share it as widely as possible. The campaign is going to be really broad, focused on adults, so 18 and over, Sussex wide, and we really want it to reach as many people as possible. So yes, it's just a plea that when it launches, if you can help us to spread it as widely as possible to hopefully help people to get help at the earliest point. So that's my plea. We're now going to move over to our panel discussion. So thank you for listening to my little monologue at the start of the session. I'm going to introduce our panel for today. So we're joined by Andrea Potter, Glenn Macready, Ian Dyer, Martin Dominy and Ricky Perrin. I don't know if you all wanted to introduce yourselves, as I'm sure many people on the call will know you, but in case anyone doesn't, did we want to do kind of an around the room, starting off with Andrea?
Yeah, sure. Thank you, Megan. Thank you for the presentation. Hi, everyone. I know lots of people, but just for anyone that doesn't know me already, I am the voluntary sector mental health transformation lead, so working within the transformation programme to represent the voluntary community and social enterprise sector.
Thank you, Andrea. And Glenn?
Hi everyone, I'm Glenn McCready. I'm the Clinical Operational Manager for High Weald, Lewis and Havens within Sussex Partnership, and I've been heavily involved in the Community Transformation Programme.
Thank you, Glenn. And Ian.
Hi everyone, I'm Ian Dyer. I am the Programme Manager for Mental Health Integration. I work across East Sussex County Council and NHS Sussex, and I provide some of the systems leadership and project management support into the transformation programme here in East Sussex.
Thank you, Ian. And Martin.
Thanks, Megan. Obviously, similarly funded with Andrew and the VCSE transformation. So we're kind of focusing on the East Sussex Brighton, but also working the central team, and really looking forward to today's webinar.
Thank you, Martin. And last but very much not least, Ricky.
Hi there, my name is Ricky Perrin. I work for a charity called Possibility People, and I facilitate the East Sussex League, which is the Lived Experience Advisory Group.
Thank you, Ricky, and thank you all for being here today. So our session today is very much focusing on East Sussex, so the developments of the neighbourhood teams and of the community transformation work more broadly within East Sussex. So now we're going to hand over to all of you. So if anyone has any questions that you would like to ask our panel, you can put it in the Q&A box, you can put it in the chat, or you can raise your hand and we'll come around the room. I know going first is often something people avoid, but please don't be shy. We're obviously here to be able to support with your questions today. And thank you, Vicky, for putting your hand up. Would you like to come in? Hi, Vicky. Did you want to come in? I think you're showing on mute at the moment.
Yeah, I work in the SOAMS team in Eastbourne. I'm just wondering when sort of staff and teams will start to get information on how their roles and teams are going to alter, because we haven't had anything at all yet, other than just being advised that the area we cover is going to reduce in size, and so that may have an impact for people working. And, you know, obviously the uncertainty has an impact on staff wellbeing and things like that. And I think various staff members are asking in meetings and in team meetings, and we're just being told that there isn't any information. So when will that start to filter through?
Do you want me to answer?
Thank you, Glenn.
I was going to mention, first of all, that there are staff packs that are imminently about to go out, hopefully this week. Do you know, Megan? Yeah, I'm seeing some nods. And that will have a lot of information in it. I know that Padma and Joe Mitchell, who work within SOAMS, in a leadership role, have been round to SOAMS teams. I'm not sure if you were able to be there at that particular meeting.
I was, but they weren't able to give sort of any specific details.
Yeah, the details. Yeah. What sort of detail are you after? I wonder whether we might attempt to try and answer your question on it now, because I think there is quite a lot of information out there, but obviously it sounds like it's not always landing. And I wonder if there's a particular concern or question that you have that we might try and answer for you.
Well, I guess, yeah, I mean, I understand that we're changing slightly the geographical boundaries of areas that are covered. And at the moment, Eastbourne SOAMS, you know, covers Eastbourne, Hailsham, around Pevensey Bay, that sort of area. My understanding now that's going to be reduced to just Eastbourne. And, you know, Padma indicated that that would have an implication for, you know, staffing and things like that, but wasn't able to give any further detail. And I understand that you're going to be working in the IST model. And again, we're not clear, how is that going to work? If staff in SOAMS going to be moved over, you know, there's not really any detail in what's happening.
Sure. Okay. So firstly, your question was around the boundary change and potentially staff movement. if Eastbourne is shrinking and Wilden is growing, I guess the answer to that is that we're currently putting together teams at the moment. I'm hoping that would be out in the next few weeks. It needs to be, because it's holding everything up. It's a complex operation because we need to think about every discipline, every grade, you know, not just within Sussex Partnership, but within the whole structure. So all of the organisations are doing the same process at the moment. But I do realise that is, you know, the lack of clarity or the conclusion of that is holding up progress, because as soon as we have that, the next stage is we'll be bringing together the neighbourhoods and you know, across the whole patch, and really focusing on, you know, first steps. What can we do straight away? Quick wins. What projects do we need to, you know, focus on next? And I think it will feel a lot more real once we've defined the teams. And so I really do feel, you know, your pain, and I really do understand where the question's coming from. All I can say is that hopefully, and it's obviously not, you know, I'm not working in isolation as I've explained, but hopefully that information should be out within the next few weeks. If it's not out, you know, before Christmas, it really is going to hold us back, because we need to start planning those sessions, as I've said. The other part of your question was around the IST model. For those that don't know what that is, it's the intensive support team. Now, Brunswick ward has closed down. We've had some money that's been reinvested into the community from that, and what that it means in practice is that all of the SOAM services in East Sussex, I'll focus on East Sussex, is getting some extra money, which is really welcomed, isn't it? And so the intensive support that we're able to give at the moment is going to grow and develop, and we'll be able to offer a lot more. And we're putting together that offer at the moment. We've just written like an operational policy for it. It's based on the West Sussex model, and we're just going out soon to advert for the new practitioners, and so it will just add more resource to what we already have. So I'm sure you'll agree that would be really welcomed.
Thank you, Glenn. Martin, did you want to add anything on that at all?
Yeah, and I know you put in the chat, there's going to be the staff packs going out at the moment, isn't there? And some of the letters and some of the kind of communication to the kind of people that are using servers as well. And that is kind of quite general information, because like Glenn said, that we've still got a few stages to go through before we can really kind of start to define our teams. But that will be followed by additional kind of comms around kind of, you know, who's in the neighbourhood, or, you know, exactly into that detail that you were asking Vicky. But it's also just a kind of an offer, Vicky, really, because obviously I joined some of the kind of meetings with Joe and Padma as well, that for us to come back into your teams and have those kind of further conversations once we kind of have a, you know, that defined detail for you as well. Megan, there might have been a little bit of miscommunication around the intention support and ICTs as well, so I don't know if we need to clarify that. So the integrated care team for the ICTs, and again, Vicky, if you wanted to speak to that, Ian's our kind of leading expert about why we've actually kind of used those same footprints, but there might be other questions that come up as well. But we have a resident expert in that, Ian.
Yeah, no, I think if you and Padma could maybe come back to the team, because I know a lot of us, you know, we're not really sure what's happening and the impact that's going to have on our jobs. So to get some clarity over that would be helpful. Thank you.
Yeah, well, I'll speak to Padma, Vicky, then, because we meet regularly, and then see if we can start to plan that.
Great, thanks.
Thank you. So we've had a couple of questions come in via the Q&A box. There was one question here from Richard, which is around the letters that have been developed for service users and clients. And Richard asked, will they be sent out in a mass mail out? And if so, when? I have added a comment in there, but just kind of for everybody's kind of awareness. We've developed the letters centrally within the programme team. They've now been shared with our local leads in East Sussex, West Sussex and Brighton and Hove, so that they're then able to determine the most appropriate way to start sharing those with people. So I know that for some organisations, they'll take an approach where they will post them out. For others, it might be that it feels more appropriate for them to kind of print it off and discuss it with a person when they've next got their appointment. So what we've suggested is that they take kind of an approach that feels appropriate for the people that they're working with, and for their teams. But I don't know if anyone else on the panel wants to add anything to that at all.
Yeah, just to kind of add, really, part of the kind of the work that the operational delivery group is to really consider around kind of safe transitions, and how do we kind of do something that's very complex, and it is around kind of transformation as well, but doing that in a very stable, kind of considered way as well. So kind of we have kind of key principles that hopefully will be kind of reflected in some of the letters, that we don't want people's current support and treatment to be affected. And we won't be kind of, suggesting that people will be moving areas or any kind of lead practitioners if they're in the kind of their mental health distress at the moment as well. So we've got some real kind of key safety things that we've included in our programme as well. And then we're always kind of reflecting on them and considering what we're going to do, what the changes are, and what the impact are for people using services as well.
Thank you, Martin. We've got a hand up. Mokhtar, did you want to come in?
Yeah, it's just a follow-up from what Vicky has raised. I work in the same team. I'm a consultant. I'm fully aware of the program, and I speak to Glenn quite frequently in various meetings. But really, all the information so far has been quite general, and the staff packs will be general as well. I wonder, and I know different areas are moving in different pace. So Brighton is different than East Sussex, than West Sussex. Is there, as we now past October, and the talks was from October onward, things are going to start changing. Is there a clear, concrete time frame for East Sussex when things are going to happen in terms of how these teams are going to form? A team like Eastbourne, who's likely to be affected staff-wise in terms of staff movement and things like that. Is there a time frame when the team will be met with some details to say what is likely to happen, when is a consultation, if consultation is needed? These kind of fine details is really needed, because I think so far all the information has been great, the communication has been good, but it's all vague and general, nothing specific which address people and anxiety.
Thank you, Mokhtar. Is a member of our panel able to respond to that?
I think, Glenn, correct me if I'm wrong, but I think it picks up from the point you were making earlier, really, in terms of staffing arrangements, particularly within SPFT, which is going to be the biggest component part of the neighbourhood mental health team offer. The process of working out how best to align existing resources across new footprints is complicated and complex, but it is ongoing, and there is lots and lots of effort going on to it. And I think really the outcomes that come out of those processes, which are essentially internal SPFT processes, will then inform the timelines of developing teams compared to the plans around best allocations that SPFT think makes sense from their organisational point of view and in terms of responding to demand and population needs. They're the questions that SPFT are answering, and I think a lot of the timelines around how to get to that point will really depend on what the outcomes of that process are. I think Glenn's made that indication that that process should be being wrapped up within the next few weeks, we believe, and we very much hope, and we'll be able to give much more detailed information once we have that information as a programme team around how we start to mobilise some of that. So there is some uncertainty still around these questions. That is true, but we're really hoping to get it cleared up very, very soon, and we will obviously be making those communications and giving that information as soon as we can once it's been worked out by SPFT. And like I say, it is a really complicated process, and there's a lot of resource and effort going into answering that question, but there's obviously making sure we get it right, and being able to communicate properly after that. I think that's how I'm looking at this process anyway, but I will let Glenn or others come in if there's a different take.
Yeah, no, I think you've summed it up. And I mean, Mokta, as a member of the divisional leadership team and as our lead consultant for SOAMS, you're integral in these changes of advising and getting us over the line with what the team should look like, particularly the doctor setup. And it's very complex, isn't it? A lot to bring together, but we are, as I say, really focused on this, and I really hope. It's really hard to say an exact date that we'll have this information done by then, but I really do hope that it needs to be done within the next few weeks, because otherwise it's really going to hold us back. And I believe, and as I'm sure you'll agree, Mokta, there is that shared commitment to defining these teams as soon as possible.
Thank you, Glenn and Ian. Martin, did you want to add anything on that point?
Yeah, I mean, obviously, I think Glenn and Ian have covered that kind of question area, but just to want to raise that we are still kind of working behind the scenes. So when we do know, we are ready to to advance very quickly as well. So we're doing a lot of kind of background work around how we're going to bring teams together, how we're going to support managers, and making some of those other changes as well. And Andrew and others are working really hard around bringing the new the new electronic systems together as well, the patient record systems as well, because that's going to be a really important milestones as we go through the program as well. So I don't think anybody expected some of the the pressures financial that the trust have been put under, as well as some of the VCSE efficiencies as well. So we are just having to wait and go through that process in a respectful way before we can start to really move forward again into the new year.
Thank you, Martin. Julie, you've got your hand up. Would you like to come in?
Hi, it was just sharing really some of the comments that have already been made. I work as a practitioner within Health in Mind, so although SPFT work under different database and understandably work within that primary care setting, I mean, we were part of the options appraisal going back some months now, to look at that I suppose that preferred outline as to where we would sit in that, but again I suppose it's the timeline. We're aware that the band 8s are now looking at that reorganisation within the management structure, but it still feels very, very uncertain. I mean, I know you've just explained about timelines, but I think it's just highlighting how uncertain it feels and how it doesn't always feel like the communication is there. It feels very much that we're out on a bit of a limb.
Thank you, Julie, and thank you for obviously sharing what your experience is at the moment. And we recognise that in the last couple of months there has been occasions where obviously we've been wanting to be able to give more clarity around things, but obviously, as we've discussed today, things are still being worked through. Glenn, did you want to come in?
Well, yeah, I was just wondering. What you were after, Julie, in terms of, is it the way that the communication is delivered that isn't reaching you, or is it the lack of detail and clarity that you're after?
I think certainly the detail and clarity, but there are times the way in which it comes through, it seems a bit quiet, I suppose.
Yeah. Okay.
Which I appreciate, that there's lots going on behind the scenes. I know Helen's very active in.
Helen's very active in the proceedings, and we're doing lots of work together to make sure that NHS talking therapies and adult mental health SOAMs link up really, really nicely. And there is lots of good work that's already going on between those services too. So it's building on that. But I'll bring Ian in.
I was just going to mention, really picking up on Martin's offer to be liaising with SOAMs in exactly the same way. We'd be more than happy to come out to any of the Health in Mind teams. I mean, you know, we're not going to have all the answers and all the details straight away, but you know, more than happy to be communicating what we do know when we know it, and to be doing that at team meetings, you know, as much as that would be helpful. So again, I'll put my email address in the chat. So if people want to reach out and invite to team meetings, anything like that, we're more than happy. That's because we, you know, appreciate there's a lot of people that we're trying to communicate with, and so having things, making sure that things do trickle down to everyone, I think it is tricky. But if we can be there and talk to people, you know, face to face or on Teams at specific meetings, as a way of getting information shared, more than happy to do that.
Thank you.
Thank you, Ian. Andrea and Martin, did you want to come in on Julie's question at all?
Yeah, I was just going to add that something that might be helpful is that we've done some work to revise our kind of roadmap and our timeline and our project plan, sort of based on some of the, you know, we know the sensitivities around some of the work that's currently taking place, but we can share that probably, you know, post this meeting with you to sort of show and gives an outline of when we think certain activities will take place, and yeah, sort of based on those staffing and leadership structures being confirmed and what will follow what. So if that's helpful as an overview and a sort of at a glance, you can see then when we're expecting some of those sort of priority tasks to take place and give you an idea around time frame. So happy to share that with the group if that's helpful.
Thank you, Andrea. And Martin, did you want to add anything on that question at all?
Yeah, I think it's just kind of wanting to acknowledge sort of, you know, changes obviously very slow sometimes and complex, but it's also there's lots of other things going on. There's huge pressures in the system as well as some of these kind of efficiency savings as well. And I think we just want to make sure that we, you know, people do really know that we are really considering the welfare of the staff. And you know, we talk about a lot around with the core team coming together as our initial kind of phasing as well. And some of the kind of the matrix or the measures or what we really want to do is making sure that as well as, you know, people that are using services have, you know, good outcomes and good experience as well, that the staff also have a good experience. So we will be starting to kind of do some very short questionnaires as we go into our kind of new teams as well, and then keep trying to kind of learn and improve kind of, you know, people's satisfaction, their experience and their kind of support that's offered to them as well. And ultimately, we are really trying to make this as a you know, a wider system, an integrated system, and that starts to benefit everybody in their jobs as well. So, you know, ultimately, I know it's kind of a long way, but we do really want to kind of make people's jobs doable and enjoyable as well as a long term. But we know how current situations are really, really challenging for people.
Thank you.
Thank you, and thank you for your question, Julie. I'm just having a look at the Q&A box because I want to make sure that we respond to people here. So there's a question here from Michael who's asked, at what point do we consider community mental health intervention becomes appropriate? So I guess thinking about, you know, at what point do we think people would, you know, need to engage with community mental health support?
I'm happy to lead if I understand it correctly.
Thank you, Martin.
I suppose it's just trying to think about, and again we've shared some of our models as well. It's making what you were talking about in that initial stage, Megan, isn't it? Around where's the information held? You know, what can people find out for themselves? What advice and guidance can people have at that very, very early stage? And then how could the people kind of, instead of kind of going from one part of the system to the other part of the system, can find that journey easier for people as well, so that people might need some support, they might need one meeting, or they might need additional support, they might need a treatment plan around kind of their kind of support needs as going forward as well. And I think what we're trying to do is kind of, as people kind of hopefully kind of come into a neighbourhood mental health team, have all those options considered as actually what's the priority, what do people want for themselves, what works for them as well. So we've still got all the interventions that we've had before, but we've got a different way of actually working that we can actually start to coordinate and kind of communicate care much better for people as well. And if there are gaps or if there are things that we're not doing or we're not doing enough of, that's for us to really kind of work hard to actually kind of analyze those gaps, you know, use our data and kind of what's it telling us, use the feedback for people using the services to make those changes as we go through the process as well. So again, kind of everything's on offer of what's there now, but if there's things that people think that we're missing, then we really do want to know and we do want to hear, because we need to kind of start to respond to that as well. But other people might want to join in on that point as well.
Thank you, Martin. Do any of our other panelists want to add anything at all? No, I think you've summed it up, Martin. Thank you. We've also got a question here from Alan, who has asked, how realistic is it for practitioners in Highwood, Lewis and Havens who are working across both sites, so Hill Rise and Millwood, to continue working in 2 neighbourhoods with 2 service managers? And also a comment around the staff packs. Is there a definitive plan for these for colleagues, and which also we've already covered? So Glenn, I wonder if you wouldn't mind speaking to that point around Highwood, Lewis and Havens.
Yeah, sure. I think that ideally we would have people working in one neighbourhood team rather than straddling 2 or 3, because we appreciate that it's a big commitment. There's quite a few meetings with the whole system. It'd be very difficult, wouldn't it, to split yourself in 2 and go to both daily huddles that may be happening at the same time. So I think what we want to, and I think that's what we're mindful of when we're looking at teams and resources, of where we can give somebody one team to focus on. We that's the preferred option, obviously. That's what we would like to do. However, you know, finances are always a consideration, aren't they? And just the economy of scale, it would be quite tricky to say that every team gets one of everything as a minimum. Some perhaps more senior posts, you know, will be straddling 2 or 3 camps, and maybe that's okay. I don't know if I've answered your question, but I think what I'm saying, Alan, is that some people will inevitably straddle more than one, but where we can avoid it, we will.
Yeah, I think that does answer my question. And I guess it's just that apart from our 2 team leads, the whole of the leadership team works across both sites. So that's senior clinical practitioner, SNP, clinical specialist, OT, neurodivergent, link practitioner, and many of the psychological professions. So just, we are so entwined, and I'm just curious how that will play out when we are no longer so.
Yeah, sure. No, I hear what you're saying. I suppose in some respects, it's not too dissimilar to what we have at the moment in Highwood, Lewis and Havens, and indeed in the other teams where you have like a north and south team or an east and west team. So I guess we're used to doing this already. But as I say, you know, we want to limit people working too broadly so they can make a real impact in the neighbourhood teams where they're working in, because there is quite a big commitment, I think, to the various meetings, and they're not meetings for meetings' sake. They're meetings as a vehicle to bring together all of those different organisations. So yeah, I think I'm just repeating myself now.
It makes sense. And I guess I was just wondering, because there'll be 2 service managers, they might have musical differences when it comes to what they want to be spending their money on.
Okay, you throw me with musical differences.
Sorry, interesting. They might have differing opinions on how best to utilise their funds.
Yeah, one might be into Krista Berg, somebody else might be Celine Dion. But I hear what you're saying. But I think they'll still have overall management, won't they, and consistency. And part of the community transformation model, if you like, is to look at, you know, getting a bit more consistency throughout, because currently I think you would agree that if you were to go to Eastbourne, Hastings, you look at the job that each of those teams are doing, very dedicated teams doing great work, but the systems they have in place, the way they work, really quite different, aren't they? So I think that's part of what we want to do with community transformation, not just improve all of our services and raise up together, but we want to have some consistency in the offer, and there'll be, you know, evaluation tools and monitoring of how each team are doing to get greater consistency. So it shouldn't matter too much if you've got two different service managers with different opinions, because we all come together to make up the team at the end of the day.
Thank you.
Thank you for your question, and thank you for your response, Glenn. I'm very wary that Carol, you have had your hand up for a while. Would you like to come in, please?
Thank you. No, I understand why. I think, like, I work in the admin team at the Eastbourne ATS, and I think a lot of people have come to this meeting hoping to get some specifics around when things are going to happen and how that's going to impact them personally. And I understand from what Glenn has said and others that things are still being worked on, but I think the lack of communication that's actually come through to the teams has made it feel like the teams, I wouldn't say don't matter, but they can wait to be told what's happening. And I know there are webinars, but the last one that focused on our area was quite a few months ago. And there's the newsletter as well, but that's quite generic as well, rather than giving specifics. So even if we could have something that just sort of outlines what's actually happening in terms of the number crunching at the moment and what the envisaged hoped for timelines are, I think it would help alleviate some of the worries that people have about their jobs and what's going to happen to them by March 2025.
Thank you, Carol. Before I come to our panel, just to kind of respond, thank you for your feedback about kind of the newsletter and the webinar. Just to kind of clarify, obviously these forums are open to anybody. So though we know a number of staff join these sessions, they're also open to members of the public, families, carers, partners, which is why we keep the information kind of more high level. I know that there are a number of kind of staff specific kind of engagement activities that are being organised by the operational delivery groups at the moment. And I wonder if Martin, Andrew, Ian, Glenn, if you wanted to come in and give a little bit of an outline around kind of what that looks like and when staff can expect to see that happening.
Well, I'll come in to start with. Absolutely. In terms of that question, Megan, we've recently been to all of the ATS teams at various team meetings. We were at the Hastings team meeting just yesterday. More than happy to keep going around on the rounds of attending team meetings as teams want us to. We appreciate team meetings space and times are really pressured anyway, so we don't want to be imposing ourselves in any spaces at all, but we would always respond to requests and invitations to attend and be updating teams. Carol, you know, I'm sorry to hear that it feels like teams are being left out of communication. It really is not the intention at all. The team packs, the staff packs, sorry, that are being circulated within the next literally day or two. I think we'll give you some of the information that you talked about there, not all of it, because like we said earlier, some of the timelines are dependent on work that's being progressed, and we just need a few. We need some work some answers to be provided from that work before we can really understand what the timelines are. But within the staff packs, there is some information around what we think is likely to that we think we can realistically deliver by March, and what that might mean for job roles. In a nutshell, we don't really think that there's going to be huge changes to where people will be working in terms of bases, any extra management changes over and above what, of course, are being proposed through the SPFT consultation. So there's some of that detail, that's in those packs. More specific timelines will have to wait until we get some answers from some of these internal processes, like I say. But I guess just that general point of teams being involved and communicated with, if we're not getting that right, we're more than happy to do whatever we can to try and fix that. And I think probably the easiest thing I think is around attending team meetings, but we're more than happy to do that on a basis that works for the teams. rather than us coming up with any timelines ourselves around that. So yeah, again, it's just open invitation really to have us attend and discuss and speak. And there's other places to be involved around the Community Transformation Partnership Group. Staff members can come and be a part of that space where plans are considered and discussed. So we really do want to have teams and clients front and centre of all of this. So if we haven't got that right, then I'm more than happy to review and try to fix that, because it's incredibly important and we know that.
Okay, thank you. Just to remember as well that some of us don't work full time, so we're not always able to attend team meetings either. So
absolutely, yeah.
Any other form of communication would be very welcome.
Yeah.
Thank you.
Thank you, Carol, for your question, and thank you for responding, Ian. I don't think we've got any other hands up, so I'm going to come back to the Q&A box. And there's a couple of questions that have come in, which I've tried to respond to as I'm conscious of time. There was a question here around the letters that we've spoken about. Is there a plan for them to go out to carers as well? And I just responded to say that at this stage, there isn't a separate letter that's been developed that's specifically for families and carers. However, there is obviously a range of other information and communications that we've been developing so that we can communicate with obviously a number of different groups, including families and carers. But similar to what Ian said, you know, if there is kind of other things that we should be considering and doing, please do obviously let us know. I'm very happy to put my email address in the chat, but equally we have also put the team's email address in there. So if anyone has any kind of suggestions or feedback around what else we could be doing to communicate with this particular group, then your feedback is very, very welcomed. Jess also asked if there is a timeline for the electronic patient system. So I commented to say that I believe, and Andrea, if you can come in, that would be very helpful, as I know you're involved in this. I believe that the plan is for the new electronic patient record to launch for community services and teams from the summer 2025. But Andrea, you're able to come in and confirm if that's right.
Yep, that's correct, Megan. That's the proposed timeline at the moment. So looking at community mental health kind of being second in terms of receiving the new electronic patient record system. So we're looking at sort of July of next year is the proposed time frame at the moment.
Thank you, Andrea. And yeah, there's a lot of work underway within Sussex Partnership, also working closely with our partners to develop that. So if anybody is interested in being involved in that work who isn't already, do drop us a note and we can obviously try and link you in with the appropriate groups and meetings. There's also a question here from Paul, a very helpful suggestion actually, in that once the new structures have been established and settled, it would be useful for us to develop a diagram, and suggested it could perhaps look a bit like a tube map to help people to be able to navigate the system. I think that's a really helpful suggestion, and obviously we want to make sure that once the new neighbourhood teams are established, we can obviously communicate and share that with people in a way that will be hopefully helpful. So I think that's a really good suggestion, obviously using kind of a visual way and a tool to help people to do that. So I will make a note of that, as I think that could work really nicely. So thank you. Okay, I'm just checking that we have responded to everybody. I think we have in the Q&A. There was a couple of questions that come in on the chat, which between us, I think we've been responding to. We've got 5 minutes left of the session, so I don't know if anyone has any kind of final thoughts that they wanted to share at all. Just to kind of reiterate what I said at the start, I'll circulate the recording of the session today, as well as the slides round to everybody who registered for the webinar. And we'll also include kind of a summary of the questions that were asked and the responses that were given. We've also got a number of different frequently asked questions that we've developed for specific groups. So we'll also incorporate some of the questions that have come up today into those frequently asked questions, as they will hopefully be helpful for others as well. So I don't know if anyone has any kind of final thoughts before we close today.
I was thinking, Megan, that a lot of the feedback today has been around frustrations about the lack of clarity around particularly the teams, and just really wanted to know for people to know that we feel that frustration too, and we are really committed to getting that information as soon as possible, because we know it's holding everything back. We can't engage with the new neighbourhoods, we can't implement the model. There's a lot we can't do until we've defined the team. So hopefully people have had some assurance that we feel that pain, and we are really working hard to get that over the line. But just also to remind people as to why we're doing this, and it is to bring about a really good integrated model of care, and service user groups have been heavily involved in this, haven't they, Ricky? And really committed to and believe in these changes that we're making. I don't know if you wanted to say anything, Ricky. Sorry to put you on the spot, but
that's okay. I can go very quickly. I know we're running a long time, but yeah, in East Sussex, we've had our lived experience advisory group members. We've had 2 members attending all of the ODG meetings, the operational delivery group, and almost all the communications that are coming through to the lived experience advisory group are also going through to the Sussex co-production and lived experience groups as well. And we're batting and balling everything. And I can tell you that our lived experience advisory group members are really championing that we want to put the client at the heart of the changes that are coming. And we're saying that you can only do that if you get all the staff on board and have them buy into the system as well. And I speak for myself and the league members, and we're championing that at every meeting that we go to on behalf of the staff and of the clients.
Thanks, Ricky.
Thank you, Ricky. Well said, and thank you, Glenn, as well, just for, I think it's important to help kind of bring us back to the why we're doing all of this, and also that overall ambition of just trying to improve the way that people access support within the community, and how we can work in a much more joined up way together as different colleagues and teams and services, and breaking down those organisational boundaries that have existed up until now. Martin, you did have your hand up. Did you want to come in, or?
No, I think it's really healthy to leave for the final word from Ricky, to be honest. So.
Thank you, Martin. Andrea, did you want to come in?
Yeah, no, thank you. Just wanted to say as well, yeah, I think just the comment around kind of knowing when the engagement and communications will be taking place, that we can look at, putting together, I know you do this anyway, Megan, around future webinars, but just having an East Sussex version that will show you kind of when we're coming back to talk to you as a whole, or to individual teams as well, so that you can kind of see that timeline. We could look at that too.
Thank you, Andrea. And yes, just to kind of reiterate that obviously we really want to make sure that the communication and the information that we're sharing with people is helpful. So if, as Ian discussed, and as I know a number of us have said today, that if there are things that we're currently not doing and can and should, anything that would be helpful, to help give you the information that you're looking for at this stage, then please do let us know. As we don't want anybody to be feeling like they don't know what's going on and what it means for them. We really want to be as supportive as we possibly can be. That's why we're here. So please do reach out to us so that we can start thinking about what those other things are. But just we're exactly on 1 o'clock now. So just to say thank you to all of our panelists for today. For responding to the questions that have come in, and thank you to all of you who have attended today, for the questions that you've asked, for the comments that you've shared, and for your kind of experience and feedback of how kind of things are feeling at the moment. Thank you for doing that. It's really, really helpful, just to help give us a sense of kind of how things are going and where we need to obviously focus on. So yes, we'll be back again on the 18th of December. We'll be having a West Sussex focus then, but for anyone on the call who has kind of a Sussex-wide role, that will still be relevant to you. And as I say, I'll circulate the slides and the recording around to everyone who's registered. So please do share that widely with colleagues and contacts that will also be interested in this work. And thank you. I hope you'll have a really good afternoon.
Thanks, everybody.
Thank you.
Thank you very much. Bye.